Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Morning and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams. I'm the chairman of the Department of Medicine at University of Louisville, and we had a marvelous medical grand rounds today presented by Dr. Connie Rhee, who is Associate Professor of Medicine and Public Health and Interim Chief of the Division of Nephrology, Hypertension, and Kidney Transplant. She's also Vice Chair of Clinical Research for the Department of Medicine, and she made a spectacular presentation on the role of plant-based diets in chronic kidney disease. And Dr. Rhee, can you summarize for us the top points of your grand rounds?
Absolutely. Thank you so much, Dr. Williams. And it's been such an honor to be able to participate in the University of Louisville Medicine Grand Rounds. So in terms of some main take-home points to share with colleagues, number one, dietary interventions, including a plant-dominant low-protein diet, are cornerstones in conservative and preservative management of chronic kidney disease. And clinical practice guidelines support low dietary protein intake in CKD patients to reduce the risk of CKD progression and death. There's also increasing evidence that plant-based diets reduce the risk of incident CKD, CKD progression, risk factors for kidney disease, and CKD-related complications. Number two, growing data also suggests that higher dietary fiber intake reduces uremic toxic generation and cardiometabolic risk in both CKD and non-CKD populations, although we need further research in this area. And finally, number three, the practical implementation of a plant-based low-protein diet in CKD should include an individualized and tailored approach that utilizes multidisciplinary collaboration with specialty trained kidney dietitians and monitoring for metabolic complications and adequate dietary protein intake using protocolized validated nutrition assessments. Thank you.
Well, that's really fantastic, and really appreciate all of your insights and your continued research into this area that could save so many lives and lower our healthcare costs because of the big burden that we have for chronic kidney disease in this country. Thank you so much.
Thank you. It's been an honor.